straight legs. I think these are got swollen elbow as well. That's got. Well, I know most vets wouldn't even spend time.
Well, they cut it open and then said we don't know what to do with it for £4 grand for investigation. So
they cut
one of them to try and drain it.
And they charge £4,000.
No, they wanted to go
approach him. And put your hand out. Put the arm out. In my opinion, it is very unlikely that this young dog is just being reactive just because he wants to be. The genetics of the breed says yes, but also I look at the anatomical concerns. The ears are to the side, swollen elbows, so we have reservoirs of pain. The modern way is to also have a medical health check for the dog. So, finally down, and nurse, what are we doing here?
So we're just placing an IV cannula, so it just gives us IV access to the vein. So it's a safer method when putting an animal under anaesthetic.
And I'm loving the protocol that you're following because you've gone through the back leg, which means that the nurse, the vet is safer.
Yeah.
So this really makes sense. Safety comes first.
Yeah, and then we can administer medications as well.
So Woody is here to check his ear and also to assess his health lobe. He's been suffering with the ear infection and get quite nervous when you approach his face, both the stranger and the owner, and this often is related with pain. So we're going to investigate any underlying issue of pain. That is very important every time there is some kind of behavior issue, because it often is the underlying reason that they misbehave. And it's very important to be able to observe analyze the ear inside very well. So sedating him will allow us to have a good view, will allow us to take cytology to look under the microscope. That is essential part of treatment plan. And then obviously we will also be able to flush the ear, so we will remove most of the secretion that is inside the ear, reduce the bacteria that are inside the ear through the flushing before be able to initiate the proper antibiotic for it.
We offer a turnkey solution at our academy, and what we want to be sure before behavioral modification is that we are dealing with all underlying concerns. In our state-of-the-art clinic, we can take instant x-rays and instantly audit what they mean.
They can sample for cytology. I'll probably do on the next one because we check this.
Okay, so this was just in the right ear.
So we're just going to collect culture and sensitivity.
Our client is a dog. We speak on behalf of the dog. And chronic ear infections, in fact, any reservoirs of pain, will definitely cause behavioral issue.
Okay, so we're just doing the second ear now. You can see there's quite a lot of dirt coming up from that one.
Before these dogs are euthanized, are proper health MOTs being done? It is shocking what we find in the ears of these dogs. Look at this matter now. How could the dog be comfortable? I don't say it to be inflammatory, but I say it because it is critically important that this is now addressed. Dogs cannot continue to go to vets and just take ear drops without proper clinical assessment. Okay, so we have Woody, 10-month-old German Shepherd, and we've just done a health MOT, is that correct?
Yeah.
So what are we seeing?
So there is some subchondral sclerosis
You can see it right here.
but there is also a chip of bone and that is toward, can you see this little
Sure.
fragment there? So this could be an indication for a fragmented coronary process. So is that is prono as one of the type of elbow dysplasia. Now usually check will be seen better on CT or arthroscopy, but it's usually something
But you
that
can
we
see
would
this
be
line
working.
here also here, this whole
That's
area.
normal. That's
normal.
overlapping between the ulna
Sure.
and
And
what
this
is
gap
the-
here?
That's normal.
That's normal, okay?
The
So
only
the
thing
discrepancy?
that so the only thing we are a bit suspicious is
This area. Okay. All right. Thank you very much, doctor. He seems to have splayed legs. I think these are got a swollen elbow as well. That's got,
See the vets telling the lady that
well, I know most vets wouldn't even spend time.
well, they cut it open and then said we don't know what to do with it for £4 for investigation. So
They cut
they cut one of them to try and
And they-
drain it.
and they charge £4,000.
No, they wanted to go further.
This is a common conversation that we are having with dog owners, and the importance of clinical diagnosis before any procedures are carried out. I mean, with what the client has just said here, I think that the proper approach would be the approach that we're following. There must be an x-ray to understand exactly what are the principal triggers that are causing the swelling in the elbows, so that we can make a clinical decision and then follow an appropriate protocol to resolve the concerns for the dog. This is what we're doing at Noah's Ark, and there is absolutely no shortcuts that will be taken under my governance.
some inflammatory cell
And this is ear cytology, yeah?
ear cytology. So we can see some cocci. There are no rods, that is the important thing that we generally look for. And there are intracellular bacteria, so that means there is an active infection and inflammation inside the ear. We're much less concerned about, obviously, Pseudomonas because we cannot see any rods.
Fantastic.
When a medical concern causes reservoirs of pain and distress for an animal every single day, is it unreasonable for the dog to be acting out of character? Is it unreasonable for the dog to be showing aggression because it doesn't want you to touch painful areas? When you fix those reservoirs of pain, the outcome is usually very, very positive. We are proud of our grooming section at Noah's Ark. Proud of our purpose-built dental facility. Proud of our brilliance in using K-laser for BOAS surgery. K-laser for pain management. Modern science for arthritis and a modern x-ray room. Speciality in dental care. With the state-of-the-art ultrasound, we believe in modern technology. K-laser is a fantastic modern equipment that we have to support your pets at Noah's Ark. Another USP that we have is the availability of a call-out ambulance for those that cannot travel or for the pets that do not travel well.